Alright, I'm reading the Privacy and Protected Health Information out of the Reference Guide to Regulatory Compliance on paper page 912 of the old text. In 2009, Congress enacted the Health Information Technology for Economic and Clinical Health High-Tech Act as Title III of the American Recovery and Reinvestment Act of 2009. This law expanded the coverage of the Health Insurance Portability and Accountability Act of 1996, HIPAA, that, among other things, established privacy and security requirements for companies handling the personal health information of or on behalf of their customers. Thus, HIPAA was the first statute to require protection of individuals' personal health information, and that protection extends to payments for health care. Doctors, hospitals, health insurance companies, pharmacies, and similar firms are directly covered under HIPAA. In addition, banks that engage in certain activities with such healthcare companies are deemed to be business associates of healthcare provider customers. However, business associates are not directly subject to the HIPAA privacy and security and penalty requirements. With the passage of the HITECH Act, established breach notice provisions and increased the penalties for violating HIPAA. Business associates now have direct rather than contractual duty to keep protected health information secure and to destroy such records in a way that prevents their unauthorized disclosure consistent with banking law requirements. The Department of Health and Human Services now has the authority to audit BAs for compliance. The HHS issued interim final rules in 2009 that became effective in February of 2010. Coverage. Covered entity means either a health plan, a healthcare clearinghouse, a healthcare provider who transmits any health information in electronic form. Business associate of a covered entity is a person who performs or assists in the performance of a function or activity involving the use of or disclosure of individually identifiable health information or provides legal, actuarial, accounting, consulting, management, administrative, accreditation, or financial services to a covered entity. Protected health information. Individually identifiable health information that is transmitted by electronic media, maintained in electronic media, or transmitted or maintained in any other form or media. Individually identifiable health information is created or received by a healthcare provider, health plan, employer, or healthcare clearinghouse and relates to the past, present, or future physical or mental health or condition of an individual, the provision of healthcare to an individual, or the past, present, or future payment for the provision of healthcare to an individual, and that identifies the individual or with respect to which there is a reasonable basis to believe the information can be used to identify that individual. D. Financial institution exemption. HIPAA exempts payment processing by financial institutions, including authorizing, processing, clearing, settling, billing, transferring, reconciling, or collecting a payment for or related to health plan premiums or health care, where such payment is made by any means, including a credit, debit, or other payment card or account check, or electronic funds transfer. However, if a bank engages in additional activities such as lockbox services, back office billing, payables management, and accounts receivable activities, those activities are subject to HIPAA and require a BA agreement with the covered entity. Information breach. 1. Definition. 1. The disclosure of protected health information in a manner not permitted under the regulation which compromises its security or privacy. For example, the breach poses a significant risk of financial, reputational, or other harm to the individual. 2. The breach that does not include the individual's name, address, fax number, email address, social security number, medical record number, license number, device identifiers, serial numbers, or biometric identifiers does not compromise the security or privacy of the protected health information. Exclusions from the definition of breach: any unintentional acquisition, access, or use of protected health information by a person acting under the authority of a covered entity or a business associate within the scope of authority and in good faith, which does not result in the further use or disclosure in a manner not permitted by the regulation. B. Any inadvertent disclosure by a person who is unauthorized to access the information at a covered entity or business associate to another person authorized to access the information at the same company, and the information is not further used or disclosed in a manner not authorized hereunder. Subpart 2 requirements: maintain administrative safeguards. Must adopt policies and procedures to prevent, detect, and contain security violations. 2. Conduct a risk assessment to determine the level of risks to electronic protected health information maintained by the institution. And 3. Implement security procedures sufficient to reduce risks and vulnerabilities of information breaches to a reasonable and appropriate level. 4. Apply appropriate sanctions to employees who violate the policy or protection procedures. 5. Regularly review records of activity, audit reports, and incidents of security activity. 6. Identify a security officer responsible for the security program. 7. Implement a system so that only appropriate employees have access to electronic protected health records. 8. Ensure that all locations where access is permitted and all employees with access are supervised. 9. Determine that each employee's access to electronic health records is appropriate. 10. Determine access to electronic protected health records when appropriate. 11. Implement policies for authorizing access to electronic records. 12. Conduct appropriate training for staff and management. 13. Implement a security program with periodic updates, login standards, password management. 14. Develop a program for responding to security incidents and breaches. 15. Develop a disaster contingency plan, including a plan for creating copies of records, a restoration of data, enabling the continuation of critical business processes, periodic plan testing, and assessment of the criticality of all applications. 16. Periodically evaluate the security plan to determine that it complies with the law. And 17. Ensure that business associate agreements are in place and in compliance. Letter B, maintain physical security of information. Implement policies and procedures. Number 1, A, limit access to electronic information systems in the facilities in which they are housed. B, allow facility access to support restoration of lost data in case of disaster. C, prevent unauthorized access and information tampering and theft. D, validate and control individual access to the facilities. E, document maintenance, modifications, and repairs to the physical elements of the security of such facility. F, to specify proper workstation functions to be performed and the physical attributes of the workstations with access to electronic protected health information. G, govern the receipt and removal of hardware that contains electronic protected health information into and out of a facility. And H, address the final disposition of electronic records and the hardware they are stored upon to remove them from the reuse the media. 2. Implement physical safeguards for workstations with access to protected health information to restrict access to authorized users. 3. Maintain a record of the movement of electronic records and the persons responsible for them. 4. Create a retrievable exact copy of electronic health information before the equipment upon which it is stored is moved. C. Maintain technical safeguards. 1. Implement technical policies and procedures for electronic protected health information that limits access to authorized individuals and software programs. 2. Assign a unique name or number to users to enable tracking capabilities. 3. Develop procedures for obtaining electronic information in an emergency. 4. Establish log-off procedures that terminate sessions after a predetermined time period. 5. Implement a mechanism for encrypting and decrypting information whenever appropriate. 6. Implement hardware, software, and/or procedures that record, and examine activity in information systems that contain protected health information. 7. Protect electronic health information from improper alteration or destruction, and systems that verify that the information has not been altered or destroyed in an unauthorized manner. 8. For all persons seeking access to electronic records, verify that a person's identity is the one claimed. 9. Implement procedures to guard against unauthorized access to an electronic network over which protected information is transmitted. 10. Ensure that electronic information is not improperly modified without detection until it is disposed of. D. Maintain policies and procedures. So, for Unit D, which likely is really close to the end, these are requirements of financial institutions that provide lockbox services, back office billing, payables management, accounts receivable activities, subject to the BA, subject to HIPAA, such that a BA, business associate agreement, would have to be established with the healthcare provider. So those are the only financial institutions that are required to maintain administrative safeguards, maintain physical security of information, and maintain technical safeguards, policies, and procedures. Did I read policies and procedures? 1. Implement reasonable and appropriate policies and procedures to comply with all of the technical and physical security necessary to implement the privacy requirements for electronic protected health information. 2. Maintain a written record of any action or assessment that is required by this regulation or by policy. 3. Maintain documentation of actions, assessments, and policies for 6 years. And letter E, notification following the discovery of a breach, the notice requirement, timing, and content of the notice. F, further required by BAs, is standard policy and procedures, business associate contracts. And lastly is going to be the enforcement section. So, the notice following the discovery of a breach must be sent by a business associate to notify the covered entity of a breach of unsecured protected health information. The breach will be treated as discovered if a business associate, as of the first day on which the breach is known to the business associate, or by exercising reasonable due diligence, would have become known to the business associate. Timing of the notice: the business associate must notify the covered entity of the breach of information within reasonable delay and in no case later than 60 days after the discovery of the breach. Content of the notice: the notice must include, to the extent possible, the identification of each individual whose unsecured protected health information has been or is reasonably believed to have been accessed, acquired, used, or disclosed during the breach, and any other information that the covered entity is required to include in the notification to the individual. Standard policies and procedures: these must be established that are designed to secure protected health information. G, business associate contracts: required contract terms, other contract terms, and contract termination. That one's easy. A covered entity must terminate a business associate agreement if there is a material breach that has not been cured. A business associate must have a contract with a covered entity that includes the following contract terms, A through J. A, establish the permitted and required uses and disclosure of information. B, provide the information not to be disclosed except as required by the contract and permitted by law. C, require the business associate to use appropriate information safeguards. D, require the business associate to report any disclosure of information that is not provided by the contract of which it becomes aware. E, require subcontractors of the business associate that have access to protected health information to agree to the terms of the contract. F, require that information be made available to the appropriate individual to which it relates as required by this regulation. G, provide the information necessary to make an accounting of information disclosures. H, require that the records of the business associate be made available to the Secretary of the DHHS upon request. And authorize the termination of the contract if there is a material violation. And J, require that information be returned or destroyed at the time of contract termination. Other contract terms: number 2, the business associate may use information necessary to properly manage its business, carry out its legal responsibilities. If the disclosure is required by law, or if it obtains reasonable assurances from the person to whom it was disclosed that the information will be held confidentially and that any information breach will be reported. Subpart 3, enforcement, DHHS retains the authority to examine any covered entity or business associate for compliance. Civil penalties will be a minimum of $100 per violation, up to $25,000, or $50,000 per violation, up to $1.5 million is the maximum. And just for future reference, DHHS stands